I was a paramedic for the longest time. For over 10 years, I was on the ground and in the air. When I decided that I was going to progress my career, I had a friend who was a PT, and he suggested, hey, you should look into being a physical therapist.
So my little sister actually was diagnosed with a bone disease in her legs that required multiple surgeries. So as a child, I was always trying to find things to help her get better to being, her playful self, being able to ride a bike, being able to go play with kids and things like that. And that kind of led me down the path of physical therapy.
I lost my mom to cancer when I was 19, and seeing her go through her diagnosis and her treatment and ultimately end up in hospice care, I always knew that I wanted to work in the healthcare profession because I admired the people that worked with her so much. I just didn't know where. I didn't know where I would fit correctly. I tried on a bunch of different hats and nothing quite felt right. And then I found out about OT.
I grew up kind of poor, in southeast Oklahoma in kind of this rural area. There's not a lot of college education, not just in my family, but just in the area. And so that was a real challenge. But my mother, she always pushed me to excel. She had high expectations. She always pushed me and said, you can make it, you can do what you want to do, you just have to work hard. I was in the first inaugural class in a Master's of Biomedicine, class of 2020. The Master's program definitely prepared me. I had the same faculty as the DO students, and even did an anatomy lab next to the DO students. It was a really seamless transition from the master's program to the DO program, and it worked out really smoothly.
I had graduated and was wanting to figure out something to do in the healthcare profession. I hadn't really gotten to the point where I knew what that was yet, and so I found the master's program, and through the master's program, I found occupational therapy. And occupational therapy, it was like opening the door into what I was supposed to be doing all along.
One thing for me that was always difficult was the belief of being a physician, because when you're a kid that you don't have anybody in your family, you don't know anybody that is a physician, it's so hard because you can't see it, so you can't believe it, When I really understand my mom's story, I see a woman that didn't know English, that came here alone, didn't have that support system. And when I was younger, I understood that I had to go to college because she didn't have the opportunity and she took that sacrifice for me. So it was something that really drove me. Whenever I work with Hispanic patients and a lot of Hispanic mothers, I see a lot of her, and I understand the problems that they go through, and it's something that's very deep for me, to just treat my patients with the same way that I would treat her. Her story is not unique to just me, but it's also something that I am grateful enough to have that helps me with the patients that are similar to her.
So my journey began here, not feeling satisfied in life, I would say that. I was going through a lot of personal issues. My life had taken pretty much a wrong turn. And I found an outlet through exercise. I knew how it made me feel and how it helped me turn my life around, and I wanted that for other people. But I always felt like a desire for more, like there was a need to help more, and I knew I could help people in other ways than just, meeting fitness goals. And that's kind of where, really started looking into physical therapy. Hearing about the school and coming to see the school and the amazing facility that it is really kind of set me on that track to okay, I want to make this a career, make this a profession.
I worked at a daycare for about 6 years, and I had some kids of mine that went to OT, and I was like, what is occupational therapy? I've never even heard of that. And I looked more into it, and I started shadowing, and I just fell in love with it. I knew it was a profession where I belonged, and I'm so happy I made that choice. When I visited AIC for my interview day, I immediately fell in love with it. The campus is beautiful, the amenities are state-of-the-art, brand new, gorgeous. And most importantly to me though was the people. Everyone is so kind here. You can't beat these people. It's amazing here.
The dean of the School of Physical Therapy came and visited my university. And I was like, wow, this place really cares about who you are. 3 years ago, I wouldn't have thought I could do something like this. So I think she really planted a seed in me the first time I met her and helped me believe in myself.
I walked into the College of Health Science, met with the faculty, and it felt immediately welcoming. I started to learn about the program and the profession itself, and I fell in love with how versatile it is and how we are absolutely everywhere, and we can and need to be everywhere as an occupational therapist.
There's an emerging specialty in the United States, which is physical therapy in the emergency room. And the idea is that the emergency room is the first stop and the first point of contact for the healthcare system for a lot of patients. Being able to see a patient in the ER and take some lower acuity patients off of the emergency physician's plate is going to be great. Different things like chronic pain and vertigo issues are well treated with PT.
We went to a local church down the road and did physical exams for elderly people. That was really cool, seeing all these people come in and being eager to let us listen to them, listen to their complaints, and talk to them about their past medical history. That's something that sticks with me because at the time I was just a first-year medical student and I barely knew how to use my stethoscope. But nevertheless, these 60 and 70-year-old people were walking in fully trusting me to do a good job. And I'll never forget that, being so nervous, but still having so much confidence poured into me at that stage when I really needed it.
Something very important to me in my future as an occupational therapist is carving out a safe space for the LGBTQ+ community in the healthcare field. I'm an out and proud lesbian, and I'm so proud to be from that community. It means a lot to me. Something unfortunate, though, is my community is a lot less likely to seek out healthcare out of fear of being discriminated against. So I would really love to make a change in that in the future. We are human. We deserve access to the equal human right of healthcare.
So I want to be someone in the future that kids from my kind of like background, they can see that, so that's something that's always been very inspirational. And that's why I always try to give back to the community and just get involved in these events because it's something that's very, very important to me.
I feel like being at AIC has really opened my mind into how driven and how self-aware I am in my day-to-day, like walking through life, knowing that as long as I stick to who I am and what I believe in and continue to practice and do my best, that I can indeed accomplish anything.
Truly, if you find a cause, if you find something that matters to you, and you use that to fuel your future, to fuel your passions, you can go anywhere. I mean, you can really do what you put your mind to.
I am Michael Gallimore, and I am the future of healthcare.
Mi nombre es Luis Murcia y yo soy el futuro de medicina.
I am Emily French, and I am the future of healthcare.
I am Lauren Murabito.
Kobe Morrison.
Christine Baggy.
Robert Pierce, and I
I
am
am the future of healthcare.